Addiction is a complicated disease. It makes people keep doing things that are bad for them. This happens because addiction changes the brain. Addiction is not about being weak or bad. It is a long-term brain disease that needs treatment and care. People with addiction can't stop even when it hurts them. Addiction affects health, mind, relationships, work, and money. It can lead to a very hard life that feels impossible to escape. Seeing addiction as a brain disease helps reduce blame and find better treatments. Treating addiction like other diseases helps us use science and care to help people. This way, we can show kindness, encourage people to get help, and support their recovery. Addiction can show up in different ways, including both substance and non-substance addictions. Substance addiction means using drugs or alcohol too much. These substances change brain chemistry, especially in areas related to reward and pleasure. Over time, using these substances can change brain circuits, causing compulsive drug use. Non-substance addictions involve compulsive behaviors without drugs or alcohol. These behavioral addictions can be just as strong and harmful as substance addictions. Common non-substance addictions include gambling, internet gaming, shopping, and sex addiction. Both types of addiction affect the brain's reward system. Both involve the release of dopamine, a chemical linked to pleasure. This dopamine rush creates a strong sense of reward, making the behavior hard to stop. Addiction affects millions of people, no matter their age, income, or background. Some addictions are more common than others. Knowing the common addictions helps with awareness, prevention, and treatment. Alcohol addiction is a big problem, affecting many people. Alcohol is easy to get, socially accepted, and heavily advertised, leading to its abuse. Nicotine addiction from smoking causes many preventable deaths. Despite health campaigns, nicotine addiction continues due to its addictive nature and tobacco marketing. The opioid crisis has caused many deaths in recent years. Misuse of prescription opioids, often for pain, drives this crisis. Potent synthetic opioids like fentanyl have made the crisis worse, increasing overdose deaths. Solving the opioid crisis needs prevention, treatment, harm reduction, and law enforcement. Spotting addiction early can be tough because it happens slowly. But knowing the signs is important to stop it from getting worse. These signs show up in how someone acts, their health, their mind, and their relationships. A big sign of addiction is not being able to stop using something, even when it causes problems. People with addiction often think about the substance a lot, spend a lot of time getting it, using it, or recovering from it. They keep using it even when it causes problems like fights, money issues, legal trouble, or health problems. Another sign is needing more of the substance to feel the same effect. This happens because the body gets used to the substance, so you need more to feel the same. As this happens, people get stuck using more and more, but feeling less and less. Addiction is a complex problem caused by a mix of genetic, environmental, and social factors. The reasons for addiction are different for everyone, but knowing these factors helps in creating better prevention and treatment plans. By studying genetics, environment, and personal experiences, we can understand addiction better and find more effective treatments. Genetics can make someone more likely to become addicted. Some genes affect how the brain reacts to addictive substances, making some people more prone to addiction. For example, changes in genes that control dopamine, a brain chemical linked to pleasure, can increase addiction risk. But having these genes doesn't mean someone will definitely become addicted. Environmental factors are also important in addiction. Experiencing trauma, abuse, or neglect as a child can increase the risk of addiction later. Growing up where substance use is common or easy to get can also increase the chance of addiction. Being around addictive behaviors like gambling or gaming can also lead to addiction. Diagnosing addiction involves looking at a person's medical history, mental health, and social life. It's not just a blood test or physical exam. It needs a detailed approach to understand addiction's effects on a person's life. Doctors use different tools and methods to diagnose addiction correctly, ensuring the right care and support. The process starts with a detailed review of the person's medical history, including substance use, mental health, family history, and other conditions. This helps understand the person's situation and find risk factors for their addiction. After the history review, the doctor will do a clinical assessment, which may include a physical exam, lab tests, and mental health evaluations. The physical exam checks for other medical issues, and lab tests can find drugs or alcohol in the body. Mental health evaluations, done by licensed professionals, look at the person's mental state, personality, and any other mental health issues. Beating addiction is tough, but possible with the right help. There's no single way to treat addiction. The best method depends on the person. Luckily, there are many treatment options to help people recover. One common treatment is behavioral therapy, which helps change thoughts and behaviors. Cognitive behavioral therapy, or CBT, is very effective for treating addiction. CBT helps people find and change negative thoughts and develop better coping skills. Medication-assisted treatment, or MAT, is useful for opioid or alcohol addiction. MAT uses medications with counseling to manage withdrawal, reduce cravings, and prevent relapse. Common MAT medications include methadone, buprenorphine, and naltrexone, each with its own benefits and side effects. Prevention and early intervention. Stopping addiction before it starts and helping early are key to reducing its harm. Treating addiction is important, but stopping it before it starts is better. Good prevention looks at many factors, from personal choices to community norms, to build strong, drug-free environments. Early help can stop addiction from becoming a big problem. Finding people at risk and helping them early can make a big difference and prevent long-term issues. This means checking for drug use and mental health issues in places like clinics, schools, and community centers, so people can get help early. Teaching kids about the dangers of drugs is very important. Good drug education helps kids make smart choices and resist peer pressure. These programs should focus on positive growth, social skills, and healthy coping methods. Recovering from addiction takes time, effort, and support. The journey can be tough, but many people have succeeded and now live happy lives. There is hope. With the right help, anyone can start their recovery and take back their life. Building a strong support network is very important. This network can include family, friends, therapists, and support groups who understand addiction and can help. Connecting with others who have been through the same thing can give hope, reduce loneliness, and offer useful tips. Managing stress is key to staying sober and avoiding relapse. Addiction often starts as a way to handle stress, trauma, or hard emotions. So it's important for people in recovery to find healthy ways to deal with stress and life's challenges. This can include regular exercise, meditation, yoga, hobbies, or getting help from a therapist. If you or someone you know is struggling with addiction, don't hesitate to seek help. If you found this video helpful, be sure to give it a thumbs up, share, and subscribe. Together, we can help break the stigma surrounding mental health. I will see you in my next video.